Good day and welcome again, viewer. This week we are on the platform Civic Engagement for Transformed Futures in Eswatini. Lungile Mnisi, your host, with two gentlemen that I'm going to allow to introduce themselves this week. Mr. Magagula and Mr. Mazibuko, you are welcome to the show and please introduce yourselves.
I am Thabo Magagula, Child Protection Officer from Save the Children Eswatini.
Mr. Mazibuko is here. Good morning.
Thank you for making it to the show. This week we are on the topic where we are looking at the effects of COVID-19 on child psychosocial and mental wellness. Growing up yesterday, we were hearing our elders saying children are to be seen, not to be heard. And today things have changed. Why should we really be concerned about psychosocial and mental wellness on children? I'll start with Mr. Mazibuko.
I'm Mandla Mazibuko. I'm the country representative for the Regional Psychosocial Support Initiative here in Eswatini. My organization is known as REPSSI in brief. So REPSSI is a leading African psychosocial technical support organization and market leader in the provision of psychosocial support services in sub-Saharan Africa. We are currently working in 13 countries in East and Southern Africa. Let me start off by defining what psychosocial support is and what mental well-being is. Maybe let me start off by saying the desired goal for providing psychosocial support is to enhance the social and mental well-being of individuals, children included. Psychosocial support, loosely or briefly, it can be defined as love, care, and protection. It incorporates an emotional, social, spiritual, and mental needs of all children. Like I've already alluded that when you are providing psychosocial support, you are all about enhancing their psychosocial well-being. Psychosocial well-being is when children feel good about themselves, there are people around them who help them, and they're able to deal with life's demands. Currently, they are facing COVID-19, which is a challenge and a demand. So if they're able to deal with it, they're able to manage relationships very well, they participate in decisions that affect them, and they have hope for their ability to cope with the life and show signs of resilience when they are threatened by risk and vulnerability. So your question, I think somehow I've already responded on what it is, why it is important to provide psychosocial support now that children are facing COVID-19 or coronavirus. As a result of what is happening nowadays, I think all of us are aware that children's routine activities have been disrupted. For instance, the schools, they've closed down, and also due to the lockdown, be it full or partial lockdown, that has led to suspension and cancellation of activities. And you would agree with me that children engage in activities that stimulate them. They stimulate them socially, emotionally, and mentally. So now that they are no longer participating in those activities, so in as far as how children are stimulated socially, emotionally, and mentally, that has come to a halt. So now that they are no longer participating in those activities, children are asking themselves a lot of questions as to what will happen to them, because things like social distancing, children are, they are social people. They want to reach out, they want to show affection, they want to touch, they want to play. But nowadays, we discourage them to do that. So now they are anxious, they are going through anxiety. Children are stressed now, children are depressed. When it comes to the school calendar year, the year started very nicely, children were so excited, but all of a sudden, that came to a halt. So children now have got tension, they've got fear, they've got uncertainty over what the future holds for them. Will they be able to write their exams? Will they be able to resume school? They're asking themselves a lot of questions. So as a result, they've got anxiety, they are stressed, and they are depressed. Let me pause there for a while.
Fair enough. I understand, as a parent myself, there's a back to school anxiety that is going around. I mean, with all stakeholders involved, we're asking ourselves questions, be it the parents, be it the students themselves, and government as well. So one is asking themselves probably, what, in your thoughts, is the preparedness level of all the stakeholders in terms of the back to school that is being announced?
Well, I think in terms of preparedness, first and foremost, you understand that when people live within a territory, the government is looked at as our guardian. And in this case, we are finding ourselves looking up to government to kind of provide direction. And that doesn't, however, take away our responsibility as parents, because we still have to prepare the children mentally that they'll be going back to school, also prepare them with the precautions that they'll have to observe. And we are watching in terms of preparedness as to what government is availing, what are the issue precautions that government is providing. One is getting a sense that we are hearing a voice from government that they are saying they are on track, but on the other hand, when you listen to parents, they are not sure of the situation. But when you listen to unions, they feel like, especially the Union for Teachers or the National Association of Teachers, they are feeling like there's still a lot of things that need to be put in place for us to declare or say of ourselves we are in a state of readiness. And the children themselves, while they could be excited, but when you look observing the numbers, it comes with some apprehension to say, we are going back to school, and how many other children that will be going back to school with us who could be in a position where maybe they are infected, but they do not know. So the state of readiness is one that needs to be, debunked, explained, and come out clear what would be the responsibilities of parents, so that parents, do not take risks. I do believe, as a parent myself, that we have to take precautions and check that, take a responsibility and avail what we can avail. Because at the end of the day, we are not going to look to government for everything. Some things will have to be done by us as parents.
True that. Mr. Mazibuko, what would be your take on, since we know that not all schools are going back to school, not all children are going back to school, the first priority has been the Form 5s, I understand, whom are going back on the 6th of July. Still, we have a role, in as much as we have a role to play still with those that are going back to school. But how can we assist those children that we are still going to be sitting at home with? How can we really ensure as parents, because this is the first conversation and probably a lot of us are anxious, parents have been anxious, they're carrying a double burden. With your children at home during school holidays, you would attest that the cupboards are emptied and now it's back to school again. How can we assist parents and children, in terms of their psychological, psychosocial and mental wellness during this time?
Let us not underestimate the fact that children are like us. They're like adults. They can also see what is happening. They can also think, they've got thoughts, feelings, and emotions. And they are quite aware that we are dealing with an emergency here. So they are also in that mode, the emergency mode. I think for us, we have to be curious. We have to ask them, open questions and actively listen to understand more about their thoughts, feelings, and emotions. Coming back to your question, that some would be going back to school, others would still be at home for a while government is trying to put in place measures and safety precautions so that when they finally go back to school, everything is in order. I think there's nothing better than having parents explain to the children what is happening, And if we do that, and also say, those who are going back to school, I think, again, they are also asking themselves, if we go back to school, are we not going to get infected, get ill, and then die? So I'm sure they're trying to weigh their options. Is going back to school worth it, or should we stay at home and be safe, like we've been saying? Because the messages have been saying, stay at home. don't move. If you move out of your home, you are going to contract the virus and die. But now we are saying, go back to school. So children are in that dilemma now to say, if I go back to school, fine, I would like to go back to school, but what are the chances that I won't, contract the virus? So I think with the ministry, with the teacher, I think, again, we have to create a plan that talks to, alleviating the children's anxiety and the fear of the unknown. I think it's time we talk about having a transitioning plan to say, how do children move from being fearful, move from anxiety, about the unknown. Otherwise, I think whatever government has put in place under these, conditions, fine. I think it is fine. It's an effort. But as parents, I think we still have got that responsibility to ensure that we do everything that we can do so that our children go back to school, but they don't contract the virus. And teachers, I trust them that while the children are back at school, they are going to do everything within their means. And I've seen some schools, I've seen some classes where even the floors have been marked to say a desk would be here. And I'm sure during the classes, teachers would ensure that children keep the social distance. But my fear is what would happen to the children when, at home, parents are there, at school, teachers are there, but between the home and the school, I'm not sure who's going to supervise the children. And children being children, I'm afraid the social distance, even the wearing of masks when there is no one who's supervising them would be a challenge. So again, I think each parent has to really, emphasize the importance of wearing the mask, the importance of, keeping social distance. And those who are using public transport again, I think those who are using those services have been trained on how to, help children who are making use of those services to keep their mask, wear their mask, keep social distance, and so on and so forth. Otherwise, I think all of us have to appreciate that we are dealing with a crisis here. We are dealing with an emergency. Government is trying, parents are trying, but let us involve the children. Let's talk to the children. Let's get their own views and opinions. Let us have them participate in all the decisions that we are taking, because the responsibility to remain uninfected, in fact, lies with the children. We may give them the information that they need, but somehow I think we have to be there to support them.
Thank you very much, Mr. Mazibuko. Let me come back to Mr. Magagula here. Mr. Magagula, what lessons, if you may, can we draw from this experience of COVID-19? Emergencies, education. There could be other things, but I just want to focus on education. Like, what lessons can be drawn, be it your public schools, your private schools? What lessons for future emergencies can you draw from this experience?
I think one outstanding lesson is that we as a country have to adopt, a different mode or way or approach to education. This has taught us that we can no longer rely on, being in a classroom situation where there is a teacher in front of learners and there are learners, sitting on chairs and desks, listening to the teacher. The issue of online learning is one that, we were able to pick from this situation to say we need to consider availing or rather using online learning. I know that comes with a lot of burden in terms of, connectivity, data, and quite a number of other amenities that go with it in terms of gadgets. But it's a route now that we have to consider, because right now we have been able to know and to see other children learning, some of the children that are in private schools, learning online, and we are getting lessons and from them as to how they are receiving and how do they feel about, participating and getting the content, but not being there physically, to kind of, engage with the teacher and engage with learners and do the discussions as they normally do. But in terms of education, this speaks a lot in terms of the country has a lot to do in terms of investing in education, in connectivity, and making sure, kind of bridge the divide between rural and urban, which is always been wide. Kind of, reach out more to urban, to rural rather, to kind of bring them to speed in terms of connecting that part of the world, so that if in the future such a disaster, strikes again, we'll be able to continue education without us getting interrupted because we cannot connect with children in the rural areas. I think that is one in terms of education, that we have to explore home learning. We have to explore home learning and of course assessments, because right now some parents are teaching their children at home and they are submitting their schoolwork. So it's one of those things, but of course it will not be done without the children themselves, because it's an engagement that they need to participate in because it's meant for them.
I know in some jurisdictions you'd find that, speaking of the gadgets, for instance, you'd find that parents have to fork out money probably to purchase Boomer tablets and assist the school system. Do you think that would work in our own setting? Because the gadget is expensive. Speaking of the gadgets, government can do that bit of connectivity and ensuring that there's network, there's access to internet at every corner of the. But do you think parents can play a role in terms of availing the gadgets and servicing those gadgets? Because it's not just purchasing. There's a lot that is involved in that medium.
Well, it's like you've put it yourself, in terms of buying these gadgets, because we are talking about investment in education. Yes, some parents may not afford this because of, poverty issues in the country that are still at at an alarming rate. One expects that, we have to do something as parents, in as much as government has done a lot to kind of, provide infrastructure for education, which we're still looking forward to more of investment to government. But at some point we'll need parents, to kind of contribute. And that's the issue of poverty then comes in to say, what about those children who are without parents at all? Say, for instance, a child-headed household who are, at school. How are they going to, access that kind of facility for them to further their education? That's where we need to come together as different stakeholders to come up with solutions, and long-lasting solutions for that matter, to make sure that we leave no one behind.
On this issue, I would also bring you in, Mr. Mazibuko, here on this issue of, I know there's been a talk even on newspapers about some schools demanding, or rather expecting pay, school fees pay, and some parents are saying, no, we are with our children at home, why should we pay? And one is thinking issues of insurance, because private schools are businesses, aren't they? So what would be your take on that issue, gentlemen?
Yeah, I think I understand where the parents are coming from, because as far as parents are concerned, I think they think that paying school fees, it's paying, okay, we pay it to keep the children away from home, or we compensate the teachers for being with the children at school, yet that is not the point. Actually, ideally, most of the teaching and learning actually should be done by, by parents. But I think maybe it's high time parents are told what the money, the school fees is for, so that they will appreciate that even now, I think it is important that they should pay, the school fees. But let me not dwell much on that, because different parents are saying different things, But my take would be, like Mr. Magagula has already alluded to. I think COVID-19 has taught us, good lessons. I think we need to consider the whole schools, because, almost all households, all families have got TV sets, they've got DVD players. So I think even without these gadgets you're talking about, the smartphones and the likes, I think the homeschools can still be done using what each family has already got in terms of the television set and the DVD player. So what should be done, in fact, would be what I would call having school-at-home packs. Ministry of Education could work with the teachers to say, let's have all the lessons, put together like in form of audio visuals, or put together even in hard copies like those materials, so that at least a parent can buy or purchase those, and then you can use those with your children without having them going to school, like if it is not safe to go to school. So things like homeschools, I think we should really look at those seriously. Things like school-at-home packs, let's consider those. Have compacted audio-visual lessons. They can even be sold. I'm sure parents can even buy those from the supermarket to say, for my grade 1, these are the lessons for the whole year. You can buy those, so that every time you use those to supplement what is taught even at school. Because even this idea of having children going to school every day and thinking they are learning every day, there's so much that is happening in a school, and the numbers in each class, classes are overcrowded. So we can't really bank on the teachers' ability that they'll be able to meet the learning needs of each and every child. So I think let us play our role as parents. We have to complement and supplement what the teachers are doing. But for us to know what our role is in as far as facilitating teaching and learning, I think the Ministry of Education has to talk to us and allow us to buy those packs, those lessons, and I'm sure in that way we'll be able to ensure that our children are learning.
Mr. Mazibuko, you've said a mouthful, and really you are opening our eyes with this discussion, and I'm hoping that we will disseminate and really get to engage as a nation, as a country, because this is the time for reflection, honestly, and for everyone concerned, all stakeholders. Probably the last question that I would love to pose to you, Mr. Mazibuko, is organizational services. Where can individuals that need psychosocial and mental services reach you, and how can they reach you? Or partners that you work with in the field? I'm seeing the need for psychosocial support for children, not only during COVID-19, but there are so many daily issues that are happening at home spaces, school spaces, and so on and so forth, that would make children really need to be supported mentally and psychologically.
Okay. Thank you very much. REPSSI's office here in Eswatini, we are with the National Children's Services Department within the Office of the Deputy Prime Minister. That's where my office is. But I don't encourage people to come and see me because I'm just too busy with other things. So our strategy as REPSSI, that is what we've always done, say for the past 5 years or so, is that we work through partnerships. What we do is that we identify strategic partners who are already working with children, providing different services that seek to enhance the psychosocial and mental well-being of children. So we identify those and then capacitate them so that they're able to mainstream psychosocial support into what they are already doing. So that is our strategy. For instance, we work through government ministries and departments. Like I've said, that we are within the Office of the Deputy Prime Minister. So we are helping the National Children's Services Department to mainstream psychosocial support in its policies, its national plans of actions, and also its programs. So those who are working, they have been capacitated to say, in the course of doing what they're doing with the children, they are able to provide psychosocial support at the same time. And then we work with institutions of higher learning. We've got a fully fledged certificate program at the University of Eswatini. It's called Certificate in Psychosocial Support. So REPSSI is working with the with the university, targeting caregivers and parents, even teachers and nurses. We've got different cadres of people who are enrolled in that program. But it's meant for people who are working directly, providing whatever services to children, to understand what psychosocial support is, so that in the course of doing what they are doing, they use the psychosocial support approach. And then we've got a program for teachers at William Pitcher and also at Mkhwanazi College. We've got a 2-year program. It's a compulsory program. It's a foundation course on psychosocial support for teachers who are at pre-service, meaning those who are training to become teachers. So for 2 years, they take 6 modules on psychosocial support. It enables them to say, once they've qualified as teachers, when they go out there to teach in the schools, they do not only focus on facilitating teaching and learning, but they're able to understand the psychosocial challenges, the effects, the mental health, and so on. So they're able to say, beyond teaching, how can I assist, my learner? So, and also we do have partnerships with civil society organizations like CANGO. We are working with CANGO in a program for adolescents and young people, especially those who are living with HIV and AIDS, to say, how do we provide psychosocial support and enhance their mental health or their mental well-being. We also work with Moya Center, with Amical Salvation Army, like different, civil society organization. So that's how REPSSI works here in Eswatini and also in the other countries, because we appreciate that there are people who are with the children 24 hours, 365 days in a year. So we say, instead of us trying to come in, we capacitate those who are working with the children, those who are staying with the children, to say, this is what you can do so that you enhance the psychosocial and mental wellness or mental well-being of the children. Thank you.
Thank you so much, Mr. Mazibuko. So each individual interested in getting these services can touch base with the stakeholders that Mr. Mazibuko has been mentioning. Mr. Magagula, do you have anything to throw as we round up, and probably the services that your organization offer?
Well, maybe to add to what Mr. Mazibuko has just said in terms of civil society has kind of positioned itself in such a way that, especially the Children's Consortium, the members in the Children's Consortium are expected or should provide, among other things, the service of psychosocial support, because the nature of our business, insofar as children is concerned, is in such a way that, most of the issues that we receive, they lean more in that area. And one can also maybe say that we work closely with social welfare for purposes of referrals. Because some of the issues cannot be handled by us as an organization, we normally refer to them. So one would say people should consider, or parents and children should consider, social access to social welfare. And I believe that most of their offices are spread nationwide. In some areas they use these containers. In some areas they have offices for them to access assistance. Our responsibility as Save the Children is to advocate for a policy, a terrain where issues of PSS are provided, in the policies, but also in terms of practice, that the offices or the departments that are endowed with that responsibility, they make that service available for children to access. Maybe, in closing, one would say children are very much today and tomorrow. If we are going to have a sound nation tomorrow, it will depend on what we have invested in them today. And right now, in this time of COVID-19, we as parents have to be there for children. And one can only lament that, it's disheartening to see some parents absent in the lives of children. Now even the more with this, emergency, because, some of the questions, some of the support that they will be, getting from parents, they're not getting from them because the parents, long distance themselves from children. Whilst we do social distancing insofar as, the virus is concerned, but let's also do some coming close to our children, to those parents who have abandoned their children.
Speaking of that, one cannot avoid, as we're speaking about psychosocial wellness on children and mental well-being, one cannot avoid the issue of homes where there's no peace, where there's rife GBV cases. I mean, probably just to throw in a word of caution there, Mr. Magagula.
One can say, during this time, when this era, came in, we together with government, we threw a voice to say, let the issues of child, violation of children, be looked at with a very strong eye in terms of making sure that as neighbors, whilst we are whether it was a partial lockdown or full lockdown, let us be vigilant. Let's check what's happening around the neighbors. Let's check what's happening in our homes, because oftentimes the people who abuse children the more are not strangers. It's the people who should be protecting them. So issues of GBV, issues of violation of children's rights, issues of child abuse, around this time we are warning and asking parents to take responsibility. That is why this issue of mental health is good for all of us, because if I'm not in the right frame of mind as a parent, if I'm not accepting the realities that are happening right now, I will pass it on to the children in terms of how I handle them and how at the end of the day, they're going to get abused. So it's very, very important that we continue to understand children, that around this time, they're also evolving with us, because we are also evolving. So let's make sure that, among other things, the questions that they ask, we respond to them well. We are there for them, we do not abuse them. Where parents or neighbors see abuse, or children themselves, when they get abused, they should report these violations. I believe that the institutions of law enforcement are there, 999 is there, social workers are there, and especially now with the restrictions being eased, they can access these services to say, I have not been well, this is what has been happening in my life. We want to have a society of children that are healthy and that are free from abuse.
Thank you very much, and thank you to my two guests. Until next week, we thank you very much for coming through for the show. On the platform Civic Engagement for Transformed Futures in Eswatini, we will be with you again for the next recording. For now, though, I would want to motivate us to go and check on our Facebook page and YouTube on Asibonisane platform. It's a platform there where we post these videos. Please do send in your comments there. We appreciate having you. Thank you very much.